And the Medical Association of Jamaica is hoping the government will move quickly to address the potential fallout from the discontinuation of the medical cooperation between Cuba and Jamaica. MAJ President Professor Marvin Reed is also warning that any system heavily dependent on external service of labor leaves countries vulnerable to external shocks.
The government has been seeking to allay fears about the potential fallout on the public health system in the wake of the end of the medical cooperation between Cuba and Jamaica. However, medical practitioners are already bracing for the impact. On Monday, we put some of those concerns to President of the Medical Association of Jamaica, Professor Marvin Reed.
There's likely to be some fallout. Individuals may not get the timely service that they were accustomed to. There may be some areas for which we're highly deficient in, and we're going to have to look to try and redress those. But the truth is, it's a human resource issue.
Despite the concerns, Professor Reed believes the government and health administrators will make adjustments to keep services running. In an emergency press briefing today, Health Minister Dr. Christopher Tufton signaled that contingency plans are on the way and outlined several measures to cushion the disruption. These include sourcing medical expertise from other countries and expanding overtime arrangements for local healthcare workers. The MAJ president cautioned that heavy dependence on external forces leaves countries vulnerable to policy shifts and geopolitical developments.
Any system that is completely dependent or extensively dependent on external source of labor is subjected to these kinds of shocks. And so at some point in time, as a medium-term strategy, the government would have had to ensure that we had these gaps filled with local folks over time. But having said that, the critical thing that we're going to face is really probably the sudden loss in service. And the expectation is that the system will adapt.
So, as the government moves to implement its contingency measures to combat the fallout, the MAJ says it will continue its dialogue with members to ensure a smooth transition throughout this time.
What we have asked our colleagues to do is independently give us some idea as to what their realities is on the ground. So once we have received that as an association, we'll be in a better position to see what the impact is and to give some advice and guidance to both our general population as well as the ministry as to how we think we can minimize this.